Great. Well, welcome everyone. I am Annika Izagiri. I'm Communications Director with the Committee to Protect Healthcare. Thank you for joining us today. As you know, members of the U.S. House are back in their districts this week for their recess, and physicians are calling on them to use this time to answer for their support thus far for massive cuts to Medicaid. The physicians joining us today will share how these cuts could impact their patients and communities and why their representatives should cease further support for these cuts. Before we begin, I'd like to note that the physicians speaking today are speaking as individuals and with the committee, not necessarily on behalf of any employers. So we respectfully ask that you please only refer to them in any coverage as they introduce themselves, and please do not include their employment information unless they expressly share that. So thank you in advance for being respectful of that. Without further ado, I will introduce our first speaker, Dr. Hughes.
Wonderful. Thank you so much. Good morning, everyone. My name is Dr. Lauren Hughes, and I'm a family physician who works in Congressman Gabe Evans' district. I'm joined by physician colleagues across Colorado today who are worried about our patients and our neighbors. We're worried because over 1 million Coloradans who rely on Medicaid, the federal state program that helps them get health insurance, are at risk of having that health insurance taken away. Republicans in Congress are planning to make cuts to Medicaid in order to pay for tax cuts for billionaires. Sadly, some of Colorado's own representatives are among those supporting these cuts. While they're back in the district during the congressional recess this week, we're asking them to listen to us and to stop their support of cutting Medicaid. In Colorado's 8th congressional district, where I work, Representative Gabe Evans voted for the budget resolution paving the way for these cuts to healthcare. And Colorado's representative in the 3rd district, Congressman Jeff Hurd, voted for these cuts as well. If these cuts to Medicaid are finalized, it will be devastating to patients across Colorado as well as to rural hospitals in this state. Colorado's Medicaid program, Health First Colorado, helps about 1.2 million Coloradans get health care. These Coloradans are part of working families. They are veterans and low-income seniors. They are people with disabilities, and they are children. They don't get health insurance through their jobs, and they often don't make enough money to buy health insurance through the exchange or directly from insurance companies or through brokers. These are the people Congressman Gabe Evans is working to take health care away from. More than 40,000 residents of our congressional district, people along the northern Front Range and Weld County, could have their health care taken away. 25% of District 8 relies on Medicaid. That's 1 in 4 people in our area, some of the most vulnerable members of our community. Why would Representative Evans support taking away Medicaid? Congressman Evans claims that these cuts will only target waste and abuse, but the math doesn't quite add up. There is simply no way to cut $880 billion from the budget without taking away health care from the very people who need it most: seniors, children, pregnant women, and people with disabilities. We cannot let these cuts become reality. We cannot let our members of Congress, like Representative Gabe Evans, take away health care from our patients, our loved ones, and our fellow Coloradans and neighbors. Now, I would like to introduce Dr. Swanson.
Thank you. I'm Mandy Swanson, and I live in the 3rd District of Colorado, represented by Congressman Jeff Hurd. I'm a family physician who does OB as well. And like my colleague, Dr. Hughes, and colleagues that you will hear from soon, I'm deeply concerned that my own representative, Congressman Jeff Hurd, voted for the budget resolution that opens the door to taking away health care from my patients. Congressman Hurd has claimed that he wants to preserve Medicaid, but there are ways to make cuts by, quote, gaining efficiencies and work requirements. From my perspective as both a constituent and as a physician, these arguments seem disingenuous to me. Medicaid is one of the most efficient forms of healthcare coverage, and work requirements simply aren't what they're made out to be. Most of our patients who rely on Medicaid already work, or they can't work because they're disabled or caring for a family member. So-called work requirements are just another way for Republicans in Congress to take Medicaid away from the people who need it to fund their tax cuts for the wealthy. Representative Hurd called the passage of the budget resolution that would cut Medicaid a win for America. But as a Coloradan and as a physician, I don't think taking away health care from tens of millions of low-income families, seniors, children, and veterans can be qualified as a win. 30% of our district relies on Medicaid, and in my community, it's even higher, one of the largest portions in the country. That means if Medicaid cuts Congressman Hurd's supports succeed, more than 60,000 residents could have their health care taken away. These are people from and families across the Western Slope and Southern Colorado, including seniors in home care, nursing homes, expecting mothers, children, and people with disabilities. As a physician, I've seen the difference that Medicaid can make for patients. When people have access to regular, affordable health care, they're able to keep serious health conditions at bay. Cancer screenings can get them better, earlier treatment. Managing high blood pressure can prevent kidney disease and stroke. But when people lose their health care, they may be forced to skip care, allowing manageable health conditions to become worse. A few of examples that I have from my own career, after the expansion of Medicaid in Colorado, I had a patient that came and said to me, I want you to know that I hate Obama and I hate everything Obama stands for. But I haven't had any of my cancer screenings because I had no insurance. But I do now because I have Medicaid. Can you get me caught up? And we did her pap smear, we got her mammogram, and we set her up with a colonoscopy. And we found breast cancer. Luckily, we found it early, and she was able to get the treatment she needed, and she's still here today. But without that mammogram, by the time we found that cancer, it would have been too late, and she wouldn't have been able to afford the treatments. I never cared about her politics, but I did care about her life, and Medicaid saved it. I also once took care of a man who had diabetes. At first, he didn't qualify for Medicaid, and he couldn't afford his medications or his visits or the specialists he needed. So he got worse. In fact, he got so bad that he was in danger of losing his feet. At that point, he became disabled, and then he qualified for Medicaid. Now he was able to get to all of his specialists' appointments. He took his medications regularly because he could afford them, and his diabetes got better. His feet got better, and he was able to go back to work. He was so happy about that. Unfortunately, when that happened, he lost his disability status and therefore lost his Medicaid, and his employer didn't offer insurance benefits, nor did he have enough money to pay for it on his own. And so he could no longer afford his specialists. He started taking his medications only every other day. He ended up right back on disability, and then he got Medicaid. I watched him go back and forth, getting better and worse, better and worse. Every time he got better, he lost Medicaid and got worse. Eventually, he wasn't able to stay better and get better, and he did lose his feet. All of what happened to him was preventable. All he needed was to stay insured. He wanted to do the right thing, and he could have kept his feet. He could have kept his job. And it would have been cheaper for the taxpayers to pay for his diabetes medicines than to pay for his surgery and his lifelong disability. Currently, my hospital has the only labor and delivery unit for 60 miles in either direction. Already, hospitals all over Colorado are struggling to keep labor and delivery open to safely take care of women and children. Without Medicaid, rural hospitals all over the state will close down. As it is, our labor and delivery will shut down on April 30th, leaving women to drive over 60 miles for care. And that's just the ones that live in this town. Many of them already drive several hours to see us. We will now add 60 miles to that care. For every 15 minutes a woman has to drive to get adequate care, the risk to her life and the life of her baby is more and more at risk. Cuts to Medicaid will ensure that more hospitals close down or can't provide maternity care. Real people will die. Real people, many of whom voted for Jeff Hurd. Cuts to Medicaid are not pro-life. Sorry. If Republicans in Congress like Jeff Hurd take away Medicaid, my patients and families across Colorado will suffer needlessly. We cannot let that happen. And I'd like to introduce my colleague, Dr. Rittmuller, to speak next.
Thank you, Dr. Swanson. Good morning. I'm Dr. Rittmuller. I'm a rural family doctor who works in Otero County. I want to start by encouraging Representatives Evans and Hurd, who are on recess right now, to engage with Coloradans who will be impacted by the cuts they've been supporting. So far, Congressman Evans has refused to hold any town halls, and my representative, Congressman Hurd, has had a tele-town hall last week, though he made it hard for people to actually ask questions and engage about his support for Medicaid cuts. I welcome Congressman Hurd to engage with constituents across his district, especially in Southeast Colorado, where we have some of the poorest health indicators in the state. Maternity and primary care are already strained by high patient to physician ratios, and poor Medicaid reimbursement is making it hard for rural hospitals, including my own, to keep services like labor and delivery units open. Medicaid cuts will only exacerbate this. Doctors know that Medicaid is a critical source of healthcare for hundreds of thousands of Coloradans, both directly in healthcare coverage and also in keeping rural hospitals open where people live and work. And Coloradans know that too. The vast majority of voters have a favorable view of Medicaid and its necessary role in helping our communities become healthier. Everyone knows someone who relies on Medicaid, or Health First Colorado, as we call it. These someones are our families, pregnant women, children, veterans, and seniors. Here in Southeast Colorado, these are hardworking men and women who look out for their neighbors as much as their own families and who help put food onto all of our tables. Many of the adults who get their health insurance through Medicaid make less than $30,000 a year for a family of three. I know so many patients who diligently account for every penny they have to provide just the basic necessities to get by. These people simply cannot afford to buy health insurance. Others who rely on Medicaid for their health care include low-income seniors and those in nursing homes. Taking away Medicaid could mean they can no longer stay in their nursing homes, leaving their families to pay the price, and many of whom would then have to stop working to care for their family member, increasing the strain on a family's limited resources. Many children rely on Medicaid as well as the Children's Health Insurance Program, also known as CHIP. These programs help millions of American children across a range of healthcare or access a range of healthcare from regular checkups and vaccines to dental care and emergency care. According to the Robert Wood Johnson 2025 County Health Rankings, 27% of children where I work in Otero County live in poverty. This is compared with 11% across Colorado as a whole and 16% across the US. Taking Medicaid from these kids could mean they're no longer able to get support for conditions like asthma, mental health, or developmental delays. They would forego preventive health checkups and have significant barriers to engage in care when they're sick. Our children deserve every opportunity to be cared for during their time of growth and development so they can thrive in childhood without unnecessary burdens and barriers, and to also be set up for success to become healthier adults. Taking Medicaid away from Coloradans will mean patients like mine will have their health problems worsen, and it will become more difficult for them to work, care for themselves, and care for their families. It means people will delay care until they're really sick and end up in our emergency rooms with worse outcomes, worse disease, and more costly care than if they had access early on. We implore Representatives Hurd and Evans to engage with us on this issue while they're in district this week and continue to engage with us when they go back to Washington. I appreciate your time today. And now I'd like to introduce Dr. Winkler.
Thank you so much. Good morning. My name is Dr. Lisa Winkler. I'm a family physician, and I live in Representative Gabe Evans's district, and I work there as well in a community health center. Taking away healthcare from Coloradans, as Representatives Evans and Hurd have supported, would be truly devastating for our whole state. If Congress cuts funding for Medicaid, Colorado would lose more than $1 billion in federal money to cover Coloradans under Medicaid expansion. Colorado would be among the hardest hit states by these cuts, we have come up with $1 billion. We would have to come up with $1 billion or else people would lose their healthcare coverage. Given that Colorado is already having to make tough funding cuts, it seems nearly impossible to fill this huge hole made by the plan that Representatives Evans and Hurd are supporting. That means the Republican plan will take away health care from hundreds of thousands of our fellow Coloradans, as my colleagues have outlined already. This includes 85,000 seniors, 102,000 people with disabilities, and over 500,000 children in Colorado alone. But it's not just Coloradans who rely on Medicaid who will be hurt. Healthcare costs for all of us could go up, as so many families are already having a hard time making ends meet. We can't forget that many rural hospitals, as Dr. Swanson and Dr. Rittmuller have outlined, rely on Medicaid to keep their doors open. Medicaid reimbursements payments allow countless hospitals and clinics to stay open to serve our communities and to take care of our community's healthcare needs. For example, the Colorado Community Health Network includes 20 community health centers and 250 clinics, providing care for about 1 in 7 Coloradans, and about half of those patients rely on Medicaid. If these patients lose their health insurance, these clinics may struggle to stay open, meaning they will have to reduce access to care for everyone. Patients suffering time-sensitive health crises like heart attacks or strokes may have to have longer rides to the hospital, putting them at greater risk for death or critical injury. Pregnant patients, as outlined by my colleagues, would also have to drive farther to their many checkups and also to give birth when they're in labor. And finally, nursing homes in rural areas may go under, may have to close, leaving seniors with virtually no options for care. Like Dr. Swanson and all physicians, I've seen what happens to patients when they can no longer get the care that they need. Hearing Dr. Swanson talk earlier, I can think of countless other patients that similarly have been impacted by losing their healthcare insurance. I've been taking care of patients in the underserved community of Adams County for over 15 years, and I've seen the substantial impact that losing healthcare coverage can have on one person's life. When a person loses their healthcare coverage, they are forced to make those difficult financial choices about their health, and very often they choose to defer or completely avoid needed medical care, leading to worsening complications and much more severe disease. Similar to Dr. Swanson's patient story, I have a very well-known patient of mine who lost her Medicaid very recently, actually due mostly to a clerical error. So despite remaining eligible for coverage, she lost her coverage for several months. In that time, she does suffer from diabetes and poor circulation in her feet. And in that time, she developed a small wound in her foot, something that could have easily been cared for in my office for very, very little resources. Our nurses could have provided wound care and we could have treated her very, very well. And unfortunately, because she didn't have Medicaid, she deferred treatment until she developed a very large infection. And that wound actually led to a multi-day intensive care hospital stay, including an amputation of her foot, and has left her with a permanent disability for something that could have been treated by nursing care in my office. All of that could have been avoided if she hadn't lost her Medicaid and if she had access to appropriate care. The impact of Medicaid cuts on the individual patient level can be absolutely huge and life-changing. But I also think that the impact on the safety net system should not be understated. Our safety net system, which for me includes community health centers, community behavioral health centers, and rural hospitals and critical access hospitals, these systems are already under significant strain, and they have already faced significant financial challenges due to the Medicaid unwind in the post-pandemic era. Many of these organizations have already needed to make significant cuts to reduce programs, close access sites, and reduce staffing because of these financial pressures. Further cuts to Medicaid will be absolutely devastating to the systems, likely forcing further closures of programs and closures of locations, meaning that patients will have to travel further to access healthcare and will likely defer care or deteriorate in the process of finding care. These proposed cuts to Medicaid will hurt all Coloradans, not just those that are affected by losing their health insurance. It will affect our safety net system in a way that will be absolutely devastating to our communities. We urge Colorado's representatives, especially Representatives Evans and Hurd, to stop their support for cutting Medicaid. Coloradans who rely on Medicaid, Colorado's rural hospitals, and all Coloradans truly depend on it. Thank you.
Thank you so much, Dr. Winkler, Dr. Rittmuller, Dr. Swanson, and Dr. Hughes. We really appreciate your advocacy and your moving testimonials. We'll now open it up for questions from the media. If you have a question for one or any of the physicians, now is a great time to ask it. You can do so a few ways. You can put it in the chat box. You can use the Q&A function, or if you prefer, you can raise your hand and we can allow you to unmute. And if that is the case, if you can please state your name and what news organization you're with. And then your question, that would be great. Thank you. So we'll allow a few moments for folks to be able to ask any questions. Caitlin, you should be able to talk now.
Hi, thank you all for doing this. Appreciate it. Obviously, the budget resolution outlined a specific target number, 880 billion for E&C to try and find cuts over the next 10 years. I'm just kind of curious, do any of you think it's a little premature to talk about Medicaid cuts and or work restrictions when that kind of legislation hasn't been put in just yet? And that's sort of what Gabe Evans is saying, that like that's not what this bill, that's not what the budget resolution does. I'm just kind of curious what you all think about that. Thanks.
I can go. Oh, go ahead, Dr. Hughes.
I think if I'm understanding your question, you're saying, is it premature to talk about how disastrous this would be without knowing the specifics? And I think no, because Medicaid is already underfunded, and cutting any money out of it rather than adding more resources is going to be devastating to our communities, almost regardless of how that happens.
You know, Annika, if I may, I'll add on to that. My colleagues spoke very eloquently about, anticipating impacts to rural hospitals, and I wanted to provide a little bit more detail around that because, Caitlin, it's an excellent question, and the reality is that rural hospitals, as an integral part of our safety net, are already struggling. I was reviewing the other day a recent report that came out from the Center for Healthcare Quality and Payment Reform that indicated that nearly 25%, 10 of Colorado's 43 rural hospitals, are at risk of closing, and 42%, which is 18 hospitals, are currently operating at a loss. And when we think about how important Medicaid is to rural hospitals, it really is a domino effect. And if I may, I'll kind of walk through those policy challenges that lead to that domino effect that underscore, I think, the importance of talking about any threats to Medicaid as threats to the safety net. And for rural hospitals, Medicaid represents a significant portion of their revenue. Without Medicaid revenue or hits to that revenue, that would lead to an increase in uncompensated care. with an increase in uncompensated care and declining revenue coming in, that would lead to a difficulty in covering operating expenses for these often fragile institutions that are operating at a margin, and maintaining services. So these institutions may be in a place of having to decide to cut services, cut personnel. And that's not a position that anyone would want to be in. Again, rural hospitals already operate at very tight margins, and so any precipitous drop or threat of a precipitous drop in revenue could push these institutions closer to closure. And one last note, and I hope in some respects this is sort of stating the obvious, but rural hospitals are absolutely vital institutions to the communities in which they're in. Absolutely, they're vital from an access to healthcare standpoint. My colleagues described very well many examples of when patients have access to healthcare, being able to identify and treat chronic diseases or potential complications of chronic diseases early to stave off long-term consequences. So rural hospitals provide that. But perhaps as, if not more important than access to healthcare locally, they are substantial economic drivers in their local communities. They are often the largest employer, if not one of the largest employers. They often provide access to the highest paying jobs in those communities. And lastly, they attract other businesses to those communities. And so if Medicaid revenues were to drop, lead to even more financially untenable situations for these institutions at risk of closure. If a hospital were to close, which has not happened in Colorado in a number of years, and we'd like this not to happen here, then within a year or two, you are looking at people moving away from that community and a decline in tax base to support other essential services. So just wanted to underline the importance of talking about even threats of cuts before all of the details are known.
Thank you both, and thank you for that question. We'll allow another moment in case there are follow-up questions. So we have a question from John. One moment. All right, you should be able to talk, John.
Can you hear me now?
Yes.
Great. Yeah, thanks so much for taking our questions. Really appreciate it. How aware would you say your patients are, the Medicaid enrollees in your areas about the risk of these cuts happening? And what are they telling you in terms of, I guess, both their awareness of it and then also how what are they doing to either speak out, make their representatives aware of how they feel about it? Just kind of how are you seeing them get involved in the public process?
I would say where I'm at in Otero County, the question of the cuts to come, that engagement is not there yet, but conversations are starting since now folks are acutely aware of the difficulty our hospital specifically is having because of the poor reimbursement from Medicaid. So right now we get on average 45 cents per dollar of care in reimbursement from Medicaid, which we take as a loss as a hospital. It's great though that we have so many patients on Medicaid because they're engaging with us, they're getting their medications, they're doing all these things, but it's hard for us then to sustain the services we need, like my colleagues were saying. So our labor and delivery unit will be shutting down end of April, and the family doctors are being let go because of that, because there's not the funds to sustain those programs. And so now I'd say our community is acutely aware of kind of that role that Medicaid plays, and now are open to conversations of, like what do future cuts mean?
And I would just add a little bit more to that from my perspective. Many of my patients have over the last several years in the post-pandemic Medicaid unwind have experienced the challenges with losing Medicaid despite continuing to be eligible to receive Medicaid. So my patients are very scared. They are talking about the potential risk of losing their health insurance. I have many patients asking for re medication refills or things like that early so that they just in case they happen to lose it or something might happen. So there's a lot of awareness and fear out there about what this means if any of these potential cuts come through. And I would say they're looking for ways to advocate for themselves and just feeling a lot of fear right now.
Thank you both, and thank you, John, for the question. I also had a question chatted to me. I'll read aloud. Medicaid is overwhelmingly popular with voters, even across party lines. Why do you think that representatives may still vote to cut Medicaid despite its popularity? And that's for anyone who wishes to answer.
And I can take a first stab at that. I think, when I hear arguments for wanting to cut Medicaid or focusing on that, it often is through a lens of concerns for waste, fraud, and abuse. And certainly for any program, public or private, if there's evidence of waste, fraud, and abuse, I would like to address those concerns. However, Medicaid, as Dr. Swanson said, is one of the most efficiently run healthcare programs that exists. And very little of the dollars spent on Medicaid go to overhead. A vast majority of the dollars go directly to services for patients who are eligible and enrolled in Medicaid. And so we need to have greater understanding of the actual numbers and the mismatch between the perception of much greater waste, fraud, and abuse than actually exists from my understanding and from my point of view. And so, despite its popularity, I think there's also an interest in addressing waste, fraud, and abuse that might be leading to support for those kinds of cuts or considering those kinds of cuts to a popular program. So that would be one point I'd raise.
I would also say that, I can't fully speculate on why, but sometimes I just feel in general, and not just in our industry, but there's just a disconnect from what's happening on the ground and what people are really going through and what's being legislated. And so I think that's part of the reason, we're hoping to have these conversations so we can, just better welcome, representatives in and say, this is what's actually happening. Come with us here. We want to work with you and we want this to be successful. We want you to be successful in representing us. Like, just let's kind of work on this together. And so I think, I hope if anything that we get those conversations going.
Absolutely. Thank you, and thanks for the question. We have a question in the Q&A from Tyler with the Greeley Tribune. With Gabe Evans not hosting town halls, how would you suggest residents go about making their voices and wishes heard?
So I can speak to that. All of your congressional representatives have the ability to contact them by phone, by email. They also have offices throughout the state in your district. If you go to their website, you can find those offices. And even if the congressman is in Washington or somewhere else in the state, there are still staff at those offices. If you're not getting through to the Washington, D.C. number, call the local office. If you're not getting through on the local office, go in person. You are allowed to talk to your representative. They need to listen to you. There are apps that can help you find your representatives' phone numbers that can help you make calls. Really get involved. I've spent a lot of times in person with the staff at my congressional representative's office, and that has led to some really good conversations and even follow-up calls where go in person, be kind, but be firm. And you can really make good relationships where they may even call you for other opinions.
Thank you, Tyler. I'm not seeing any other questions, so we'll go ahead and conclude today's call. Thank you so much to everyone for joining today, and thank you so much to our speakers and advocates, Dr. Winkler, Dr. Rittmuller, Dr. Swanson, and Dr. Hughes. We appreciate your time this morning, and hope you have a great rest of the day, everyone. Thank you.